I've been a GP in this practice for 18 years now, and for the last 3 years I've been urgent care lead for the CCG. So bringing those two roles together meant that I've had a lot of connections with the ambulance service. We know that the ambulance service have been under considerable pressure for the last few years with increasing demand. We know that our hospitals are under increasing demand, the whole system is under pressure. So we started talking about ways that we could use the ambulance service more effectively, because at the moment they tend to just be seen as a transport service, whereas they've got a lot of clinical skills and they can care for the patients. They can do more seeing and treating of the patients at home and preventing hospital admissions. Matt is the community paramedic that has joined us from the North West Ambulance Service, and he still works for the ambulance service, but he's based in the practice at least 3 days a week.
It's very difficult to put my finger on one thing which I'm actually doing, because my weeks change from week to week. The core elements of what I'm doing at the moment is supporting the GPs working. By me facilitating home visits for the GPs, it frees up a substantial amount of their time, whether it is to see extra patients in practice or spend more time with patients that need that GP input.
Matt's been able to provide that urgent response for us without us having to leave the surgery. For example, if a patient rings up looking for a GP home visit because they're very short of breath, it can sometimes be several hours before the GP is available to go and see them, whereas Matt can go and see them straight away, assess them and come back and talk to us about it and plan a treatment plan for the patient that prevents them then going into hospital.
I think it certainly prevents hospital admissions by the fact that patients are getting good assessments. I'm going out armed with much more than my colleagues are, because I'm going out armed with the patient records. And the patient records hold a wealth of information. And the fact that I can spend more than 8 or 15 minutes with them, more often than not I'm spending half an hour, 40 minutes doing a really thorough assessment with the patients. It makes a really robust system.
That link with him being able to come back to the practice and plan together for what's best for the patient, it's really helping the public perception of what the ambulance service is for.
One of the other elements which is focused quite heavily on is the care home management, and looking at ways and means in which to develop plans for care homes in order to help and support their staff.
Often in a care home though, there might not be trained staff there, might just be carers, and they don't always know how best to respond in an emergency, so we're likely to ring 999, whereas the relationship that they have with Matt, he can help support them to learn some basic first aid and look after their patients more at home rather than phoning 999. We know that going into hospital is not always the best thing for patients, particularly frail and elderly patients. Hospital can end up making them worse rather than better. And this type of role, where we bring care, acute care and emergency care, to the patient rather than transporting the patient to the care, is what we really need to be doing for the future.